Hello and welcome to the Minds on the Frontline Podcast. I'm Jeff Lassers, one of your hosts. I'm a professional firefighter, paramedic, educator, and content creator. My co-host today is Mike Mattern, a firefighter, paramedic, and peer support team expert. In this episode, we welcome Vince Waryas, Operations Director for Universal Ambulance Service and a board member of the Michigan Association of Ambulance Services. Vince has spent nearly 30 years in private EMS, starting as an EMT, then becoming a paramedic, moving into leadership, and now overseeing the EMS operations of his agency. Universal Ambulance serves communities across Macomb, Oakland, and Wayne counties, providing both emergency and non-emergency ambulance transport, including 911 response in several Michigan communities. Vince also serves as a board member for MAS, the Michigan Association of Ambulance Services, a statewide organization that represents and advocates for ambulance services across Michigan through leadership, education, and legislative advocacy. This conversation highlights a segment of the frontline workforce that bears a significant burden, but is often overlooked in the broader discussion about responder wellness: private EMS. Vince offers a practical and honest view of the realities of the job, the pressures EMS providers and leaders face, and why support must align with the actual environment where people work. This episode is a reminder that the system only works when every part is supported. Minds on the Front Line is presented by the Frontline Strong Together 5 program. FST5 offers 24/7 mental and crisis support for Michigan's first responders and their families. If you or someone you know needs help now, call 1-833-34-STRONG or visit fst5.org to learn more. Wayne State University administers FST5 with grant funding from the Michigan Department of Health and Human Services. Together, we are dedicated to strengthening the health, resilience, and well-being of Michigan's frontline community. Please follow us on social media and enjoy the show. Welcome to the show, Vince. How are you?
I'm doing great, Jeff. How are you?
Perfect. It's good to see you again. It's been quite a long time. You know, Mike just met you, but introduce yourself to our audience, who you are, what you do, and where you do it.
Sure. Well, my name is Vince Waryas. I've been working in private EMS for about 30 years now. I got my license in 1995, started out as an EMT first, progressed right on into medic, and then from that I started stepping up through the leadership positions, running certain teams like bike teams and tactical EMS teams and different things like that. Got moved into management. Ultimately became the CEO of a private company here in Oakland County. That company ended up being sold, and now I'm a operations director for Universal Macomb. But through my experiences, I'm also a member of the MAS group, which is the Michigan Association of Ambulance Services, and I'm also a board member of the Michigan Association of EMTs. So very active politically, if you will, and I also do a lot of work within the medical control zones that we work in. So I'm very busy doing all kinds of stuff.
Yeah, your agency is very spread out. You're over like 7 or 8 different counties that you provide 911 and private transport for interfacility transport to. Correct. So you're a huge group of human beings. You represent a lot of EMS providers, not only at your agency, but you mentioned the Michigan Association of Ambulance Services. Give everybody a brief overview of what that group does, who they are.
Well, the Michigan Association of Ambulance Services is a conglomerate group of multiple agencies across the state of Michigan, including the Upper Peninsula. So we have a large group of individuals that are politically active. We're very active on Capitol Hill, working on getting legislature that works for EMS, working on billing reimbursements so that, people get paid appropriately for the work that we do. A lot of different types of activities. We've also recently started working with Frontline Strong, because we recognize that our staff that we have under our employ are stressed and they need assistance. So we were looking for a better way to provide that for them, and that's how we ended up here today. So the Michigan Association of Ambulance Services is a large group of private companies. Some of them are municipal-based, some of them are purely private, some are nonprofit, some are for-profit. So there's a good mix of, the types of agencies involved, but it spreads out over the whole state of Michigan.
You brought up two of the biggest groups, the private EMS and then you said municipal EMS, right?
Yes.
Kind of let's go through and differentiate the operational and the occupational stressors of private EMS versus municipal EMS.
Yeah, how are they the same and how are they different?
Well, they're very much the same from the respect of the calls are the same, right? So when we respond to a 911 call, for example, a chest pain patient is a chest pain patient, and whether you're a municipal-based service or whether you're a private service, you have protocols that you have to follow, and you're going to treat that patient the same way, right? The differences are basically in the operational structure for some of them. So some of them operate out of stations, 24-hour stations, and when they get a call, it's a static system where they go out, they do the call, and then they return back to their station, and they wait for the next one. Others are very dynamic, where they operate under a system status management program where they're in their ambulance for the entire shift, whether that's 12 hours or 24 hours or whatever.
Oh, yeah, sit and post somewhere.
Exactly.
Oh, yeah.
That's the least healthy I've ever felt as a first responder.
Yes.
And, you know, it's interesting that you say that because that is one of the stressors that the private side does have to deal with, is the fact that they're stuck in a truck for 12 hours, 24 hours, and they can feel like a prisoner, you know, especially if it's slow and there's nothing to do and they're just
cold.
sitting post. And
you can't even get out and walk around a little bit.
Right?
Yeah.
And you're constantly, you have to find a bathroom when you have to relieve yourself. You have to go find food maybe if you didn't bring a lunch.
How do you
or something.
sleep in the truck?
You can't, not without getting, you know, a messed up neck or your back starts hurting. It's very challenging. So you get the physical stresses add to the mental stresses.
Yeah, I would say that my short experience in private EMS early, and back in the day when Mike and I were coming up, if you wanted to be a career fire service person, there was a high likelihood that you were going to do it by starting out in the private EMS world.
Correct.
Yes.
And I look back on those days as learning experiences of that was a physically demanding, hard job. We didn't run primary 911, but all the stuff you had to do and endure was physically difficult and made it very uncomfortable for very long shifts.
Yes.
You do that over a couple of years, let alone an entire career, you're going to build up a little bit of a callus, whether it's physical, mental, or emotional.
That is correct. Absolutely. And you know, that contributes to why the turnover rate is so high on the private side. I mean, the average work span for a private provider is anywhere from 3 to 5 years tops, and then they move on to go somewhere else, whether it's a fire service, nursing, PA school, medical school, or some other career altogether. They're usually in and out within 3 to 5 years because of that.
And the dynamics of the economics of that are impacted as well in some circumstances. Not all of them, because some private industries are funded very well.
Correct.
And some are not as fortunate, and there's a lot of economical issues in there where it's also the schedule, it's also what that person just wants to do with their career. So I do see that private EMS, sometimes, a large majority of people use it as a stepping stone to the next thing.
Absolutely.
It used to be more of the fire service, and it kind of still is for those, working through their education. But you see a lot of the nurses, you see a lot of people that are about to go to med school, become EMTs for about a year and kind of use that to get into their med school, which is cool. It has a part of that. So there's a lot of EMS providers in Michigan. I think the last estimates were plus 30,000 in Michigan.
Yeah, that sounds about right.
Active EMS licensure, right? So that doesn't account for guys like me and him that are in the municipal career fire service. But if you were to boil it down to the people we're discussing, which is in the private sector, 20,000? 15? That's still a lot of people.
I'd say it's at least half, probably a little bit better than half, though.
Agreed. Right. So this is a huge number. The reason I bring that up is that private EMS providers form a large part of our workforce, but often excluded from the discussions about wellness. We've had James Tignanelli, we've had Matt Saar, and we've had Mike Sauger from the Michigan FOP in here, and they were integral in making sure this program came here for all Michigan first responders and their families. And still, just based on the world as it is, private EMS kind of gets left in the dust a lot of being a first responder. Why is it vital that we make sure we include these people in these discussions to make sure they don't get left behind?
I would say that it's vital because we represent, at a minimum, 50% of that workforce, right? Yeah. And we can't get the job done without each other. Whether you're municipal or you're private side, it doesn't matter. You do the same job most of the time. We're doing the same type of work, and we can't get the whole job done without each other. So if that side of the equation becomes unbalanced because of burnout, because of stress-related issues, because of people just leaving the industry because they're fed up with whatever, there creates an imbalance. And I look at it from the perspective of congestive heart failure. And this is kind of how I've always related it to people, is that the private side typically is tasked with the responsibility of moving all the non-emergency type patients, right? So the discharges home out of the hospitals, going home, back and forth from the nursing homes, things like that. If we experience a drop in the personnel that's substantial, let's just say it's 10%, 15% due to burnout, they're just done, they're out of the industry, who's going to move those patients? Nobody, right? So then that creates a backup in the system. So if the hospitals can't get the discharges off the floor and send them home, the people that are in the ER waiting for those beds can't move up. And therefore, when the rescues come in, whether it's private or municipal, they're standing around in the ERs waiting for a bed because the ER's full, because the floors are full, and you just continue to get this backup out the door. We just had a crew the other day that was waiting in an ER for a bed for an hour and a half because there were no beds in the ER available because the floor was backed up. And then there's other times where we've had 2-hour waits at certain facilities. So that's just an example of the backup that will occur if these people burn out, and when the hospital calls and we can't get a unit there to get that patient out, it creates that congestive heart failure within the system. And you just can't get the people moving from point A to point B, and it hurts everybody, and including the patients trying to get into the ER to be treated.
Yeah.
The whole
So
system.
the mortality rates will go up because they're not getting the care that they need fast enough.
And you got an understaffed community of private EMS that do the predominance of all of these private transports. Let's just say 99.9% of these private transports are done by private EMS, and it's already understaffed, so you're trying to get them on more calls. They're getting cleared faster. They're picking up all the overtime they can imagine. This is a lot of stuff. So
It is.
In that context, what obstacles do private EMS providers encounter when seeking support? Is it as bad as they're just so busy they don't got time for that crap?
It's time and money for the most part. The municipal providers many times have a tax subsidy, right? They're tax-based. So the taxpayers help pay for the operation, if you will. And then they'll bill for their services on top of that. But the private sector doesn't have any tax revenue, all right? So they have to rely specifically and solely on the reimbursement aspects to pay the bills and make ends meet. So all the wages, the overhead for the buildings, insurances, the vehicle costs, the fuel, all that stuff comes out of the reimbursement side of it. There's no other cash flow source for them, right? So the reimbursement rates on emergency type work is somewhere between 50 and 60%. So you don't get paid on everything you do. So when you start looking at the numbers, we have a very small window of financial income coming in to pay all the bills. So there's always a financial stress. So with that financial stress, that's what causes, a little bit lower wages most of the time on the private sector because we just don't have the income to pay them more. But it also hinders our ability to train people. It hinders our ability to have brand new equipment, nicer equipment, cutting edge technologies, things like that make the job a little bit easier or better for the staff. It's because we just don't have the income source to provide that. And grants are very difficult for providers to get also. So that's not usually an option to go either. So with all that combined, they're usually at a little bit of a disadvantage. So they've got the added extra workflow of moving all these patients as quickly as they can, but yet you have not as nice of equipment. You're running them really hard. The vehicles are a little bit older. They run longer. There's just a lot more mental stress. And when things break, sometimes they can't get them in because it's so busy. So you have to kind of figure out how to be a Boy Scout out in the field, if you will, and fix it as you go and operate maybe with something that's not working 100% of the way. And you're trying to hurry up and rob Peter to pay Paul, so to speak, to try and get the job done. And that all adds emotional and mental stress on the providers as well.
Yeah, especially since the people that occupy those jobs take those jobs because they want to help. So now they feel overly dedicated to limp things along.
Right.
Which adds, like you just said.
Which is another reason why the Frontline Strong is so helpful to this type of community that doesn't have the funds, right? Now, you being a leader, I would kind of want to pick your brain a little bit. From a leadership standpoint, how important is it for EMS leaders to really kind of openly acknowledge the stress, the trauma, and the mental health challenges kind of within their organization and within the whole EMS kind of industry?
Well, I think it's absolutely vital. If we go back to the discussion we had just a few minutes ago regarding the turnover rates, one of the biggest expenses that an agency has is hiring and training people, getting them up and coming into the system. You got to bring them in. You got to put them through the initial processes, the background checks. You've got the physical testing. You've got all kinds of things that have to be done. Uniforms, a lot of operational expenses with onboarding, right? Mm-hmm. So if you're going to spend all that money getting them into the organization, you want to hang on to them as long as you can. Mm-hmm. So if we can address the mental and emotional burnout aspect, the stresses aspect, and make that employee feel wanted, make them feel like they're part of something bigger or part of the team and that they're heard and that they are understood, then they will stick around longer maybe. Not all of them, because some of them, like Jeff, you said earlier, they're going to use it as a stepping stone. They already have a plan and they're just looking for patient contact hours, right? Yeah. But you do have those that are going to make that decision that I would really like to do this, but then after a little while they're like, I can't do this, right? Mm-hmm. And it's the stress and pressures that build up and get them to that point where they decide I need to get out. But if we can capture just an additional 10 or 15% of that turnover, that would be a huge monetary savings for all the agencies, because now they don't have to keep putting more money and more money and more money into onboarding. You've already got that person. You don't have the wealth of knowledge that the people are going to leave the organization with after you get them up and running for a couple of years, the experience that they have and will leave with, that's invaluable. Yeah. So, just think about that for a second. That's priceless. That experience, all the tools that are in that toolbox of that provider are priceless. But now you got to start from scratch and start at ground zero again with a new person if that person leaves.
Now, for those leaders that are listening to the program right now, what's one practical step you think in your mind that every leader can do for their organization that will help support their people better?
Listen.
That's perfect.
Listen to them. Just talk to them. One of the things that I do on a daily basis is I'm regularly, as soon as I walk in the door, I'm mingling. I'm listening to them. I'm hearing their stresses. I'm hearing their complaints. I'm listening to everything they've got to say. It doesn't mean that I'll always be able to fix everything, but at least I'm hearing what their issues are. I'm hearing what they have to say, what their suggestions are, what challenges that they're seeing. And that keeps my finger on the pulse operationally so that I can address the things that I can address. But like I said, I can't address everything, but I will address what I can. And I think sometimes that alone is enough, just to know that you've been heard, somebody's listening. And I think they're realistic from the perspective of they know they're not going to get everything they're looking for. They're not going to get everything they're asking for. But if you try and you legitimately make an effort to try and address what is addressable, I think that goes a long way.
I think that's huge. I think the fact when people feel like they matter,
I think it's being heard. Like, yes. Good, I got it off my chest. I wanted you to know that this rule or policy or thing we have to do now is blah, blah, blah. I need you to hear that to consider it.
Absolutely.
Yeah. No,
90% of the time, I think people just need to know that, okay, I'll take that in consideration, move on to the next thing. That's all I need to hear.
Right.
And if they feel like their supervisor looks at them as people, not just a number
that
on
one
a page.
Alone.
You know what I mean? But that by taking the time just to listen, it's simple, but it means a lot to the person on the other end of it.
Every time.
Every time.
It does. And, most providers, they're not the type of people that do something just because you told them to do something, right? They want to know why. They want to know the why behind it. So, during that conversation, if there's a rational reason or there's a policy or a statute reason that we do things this way, sometimes just that education goes a long way too. So if they understand the why behind things, they're much more apt to say, oh, okay. And then, that takes that stress away.
Yeah, absolutely.
So Vince, let's go back to your role at Moz a little bit. You have a position that reflected on the availability of resources for personnel within all of Moz. Talk about that and how it addressed the use of EAP and the availability of mental and behavioral health resources.
Well, as a director with MAS, I represent the Region 2 North area as a board member. But I was also put in charge of what we call the Professional Standards Committee, kind of a catch-all for a bunch of different things that MAS is working on as far as projects goes. One of the things that was a concern for the MAS members was mental health. We recognized as a group across the entire state that there's an enigma with entering what historically has been EAP. Most agencies, or all agencies, will have some form of an EAP program for their staff, but we knew that there was a challenge with people actually entering that program because there's an enigma, right? We all know about the enigma with seeking help. Nobody wants to be that guy, that weak link in the chain. So people are not using it because they were afraid of being that guy. The stigma was holding them back.
And specifically, the EAP provider you guys were using was almost too closely related to your daily operations.
Yes, well, that was something that I discovered through the research process. But so I can't say it's happening everywhere, but
Sure.
it probably happens more often than not. Our EAP provider was one of the facilities that we transported patients to, and our staff didn't care for some of those people there, so they didn't have a trust level, right? So they didn't want to enter EAP and talk to the people that they didn't trust to begin with. So that was a roadblock.
And would you say that the word EAP makes people feel allergic to begin with? There is a stigma with those three letters strung together.
Oh yeah, there's absolutely a stigma, yeah.
No matter where it is, it feels like that's the stigma. So it sounds like you had to overcome the fact that you had people in need. You had a plan, and that plan just wasn't serving your constituency, for lack of a better term.
Correct. I would say it wasn't effective.
Sure.
Or not effective enough, maybe is a better way to say it.
Okay, fair enough.
So what we did is they tasked us with try to find a better way. So one of the projects that we were given is to try and find that better way. So we started looking around, and we looked at a lot of different things. The committee looked at applications on your phone, self-help type things, all kinds of different programs that are out there to see if we could figure out a better way to build that mousetrap, right? So we looked at all these different things. We experimented with a bunch of different things, and we would meet and discuss, and this works good, this doesn't work very good, I don't like this, I do like this, that kind of a thing. We also explored other programs that were out there, but most of those are at a for cost type thing, and some of those are fairly pricey. So that was a challenge also because, as we talked about earlier, the private sector is not flush with cash, right? We struggle with making ends meet sometimes. So we wanted to, try to relieve that financial burden, but at the same time, how could we get the programs that are needed to the staff that need them? So ultimately, one of our agencies was working with Frontline Strong at that time and suggested we take a look at that. So we did look at Frontline Strong, and we looked at all the different things that it offered, all the different programs, the CISM trainings, the teams establishing that you can do through Frontline, the programs that are offered, the help for the crews, the emergency assistance, all the different things that Frontline offers. We're checking all the boxes that we were looking for. The providers, at the time that we looked at it, your website had the state of Michigan with all the different counties. So depending on what county you lived in, you could just click that county and you could come up with a list of providers in that county. And that was an important thing to the MAS group because we covered the entire state of Michigan from the UP all the way down to the Ohio border and everything east to west from lake to lake. So we needed something that was going to span that geographical area and not be just a local company that could provide services to Southeast Michigan, for example. So we wanted something that was going to be able to hit everybody all at once, and Frontline Strong checked all those boxes. In addition, it provided all the additional bells and whistles that we would be looking for, like how can we set up an internal CISM team so that we can get the help to the people as quickly as possible, because who's going to know first when you have a bad call other than the people that work there, right? So you can get that frontline people established that can reach out to those providers immediately at the time of the incident and start that debrief process and start getting that mental healing going immediately, and then offer the additional resources as needed and as of whatever they might need so that they can take that road to the next level and continue healing so that they don't get burnt out, so they don't get into a situation where they might be considering suicide or other nasty things, alcohol, drugs, things like that, to try and get by. So we wanted to make sure that we provided what the crews needed on a day-to-day basis as quickly and as efficiently as possible. And Frontline Strong checked all the boxes. It was a great program, and ever since we've started working with you guys, it's been great. I mean, the people are fantastic. And one of the other things, if I could just tell a story for just one hot second, while this was going on, just before I was tasked with this responsibility of trying to find a better program, one of my employees at the time attempted suicide and was almost successful. Luckily, he was found by some of our other staff members, and we were able to get him the help that he needed, and we reversed that, and he's gotten help since, and he is doing much, much better at this time. He still works in EMS, so we got a win there in the win category, but this particular individual was really, really close to succeeding in his efforts at that time. And I had the opportunity to interview him. And when he went through the process of getting the help that he needed at that time, I was very much blessed to hear about all the struggles and challenges that he went through, because he did end up going through EAP. So I got to understand and learn on a firsthand basis what challenges and struggles he was faced with as he went through that process, what worked well, what frustrated him, and what parts of that whole process, if you will, might have made it worse, you know, where he was even stressed out even more going through the process than he was before. So I was uniquely situated to be able to interview and talk to him candidly and frankly about some of his experiences, and that also helped me steer towards, you know, the use of Frontline Strong, and Frontline Strong has been absolutely fantastic for us.
So, Vince, you've done a great job of really showcasing the difference between private EMS and all the other frontline workers, and everybody has their individual things that they deal with based on the community they serve, their operations, how it all works. But thank you for really looking at that and highlighting those things for us. If there's one message you want first responders and their families to take away from this conversation, what would it be?
You're not alone. We have a large number of people in the industry that have been doing this for a minute, right? People like myself that have been around the block once or twice. You're not alone. There are so many individuals in this industry that can relate to what you're going through, because you're not the only one that had a bad outcome or had a bad scene. There's a lot of people that can relate to you and walk you through what you did right, what you didn't do right, and how to do it better. Don't beat yourself up over it. One of the things that I've always taught my people is that when you have a bad scene, you have to focus on the fact that you did not cause the problem. You are sent there to help. You did not create the problem. You are not part of that problem. You're there to do what you can to help. Sometimes you can be successful. Sometimes you can't. I've seen people fall out of airplanes and live. I've seen people trip over a crack in the sidewalk and die. You just don't know what's going to happen from day to day. So you're not alone. We've seen a lot. We've done a lot, and we can relate with you. So just reach out. Talk to us. Let us know what's going on in your head. We can help you. You're not alone.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.